Okay, my name is Allie Johnson, and this is Nicole. She's going to help me out today with the knee palpations. So I'm going to start with the muscles. I'm going to start with the sartorius muscle. It originates in the anterior superior iliac spine and inserts at the pes-anserinine, which is medial. Its action is knee flexion and tibial internal rotation. The rectus femoris originates at the anterior inferior iliac spine and inserts at the tibial tuberosity. Its action is knee extension. The vastus lateralis originates at the greater trochanter and intercanteric line of the femur and inserts at the tibial tuberosity via the patella tendon. And its action is knee extension. The vastus medialis originates at the introcanteric line and the linea aspera of the femur and inserts at the tibial tuberosity via the patella tendon. Its action is knee extension. The vastus intermedius originates proximal 2/3 of the anterior femur and the interior tibial tuberosity via the patella tendon, and its action is knee extension. The biceps femoris originates with the long head at the ischial tuberosity and the short head at the linea aspera. Its insertion is the head of the fibula and lateral tibial condyle. The action is knee flexion and tibial external rotation. The semitendinosus originates at the ischial tuberosity and inserts at the pes-anserinine. The action is knee flexion and tibial internal rotation. The semimembranous muscle originates at the ischial tuberosity and inserts at the medial tibial condyle and internal rotation. The popliteus originates at the lateral femoral condyle and inserts at the popliteal line of the tibia. Its action is knee flexion and internal rotation of the tibia. The gastrocnemius originates at the lateral and femoral condyles. It inserts at the calcaneus via the Achilles tendon. Its action is knee extension. The popliteal space is the back of the knee joint. It's that little depression, small area in the back here. The iliotibial band, the IT band, originates at the anterior iliac tubercle and inserts at the lateral condyle of the tibia. Then we have the medial collateral ligament, the lateral collateral ligament, the patellar tendon ligament, which is on the patella, the quadriceps tendon, which is superior to the patella, the patellar fat pad, which is right here on the patella, the pes-anserinine bursa, which is medial and inferior to the patella. The suprapatellar bursa is superior to the bursa. The infrapatellar bursa is inferior to the patella. And the prepatellar bursa is just under the patella. Then we're going to palpate the femur. So we'll start with the eyes of the knee. So we have the shaft, which is this long bone here. We have the medial and lateral epicondyles, which we go superior. And we go inferior, and we have the medial and lateral condyles. The adductor tubercle, which is medial of the patella. The linea aspera, which is medial and inferior. It's the linea aspera. The patella with the base, apex, medial lateral borders. The tibia has the tibial plateau, the tibial tuberosity, the medial tibial condyle, and the Gerdy's tubercle, which is lateral, the lateral condyle, and then the shaft, which runs all the way down to the ankle bone and up to the patella. And the pes anserine is medial. And lastly, we have the fibula, which we have the head of the fibula, which is the apex, and it's lateral, the shaft, which runs all the way down to the ankle bone. And then the apex, which I already said. So, yeah, that's it.